Florida, I know well, we all realize that students under 16, they're not likely going to be eligible for vaccines for several months because those trials we know are happening now. So how is it in the schools with, some educators making the decision to get the vaccine, but knowing that the kids, they're not able to?
So, many of us are also parents, right? So I'm going to send my children back every single day. And they're really looking forward to that. I feel much more comfortable knowing that I'm vaccinated. Um, I think I think it definitely makes faculty and staff feel safer knowing that the vaccines are available. And we hope, right, that our kids can get vaccinated for those who choose to do so. I mean, at this time, parents are making decisions with what they're comfortable with. Some are choosing to stay all remote. There's a significant percentage of the population that will continue to stay that way. So although many students will come back, some will choose not to. And I think that that's up to a family to decide.
Dr. Zawicki, I know the CDC experts said they were persuaded to lower the distance because of the low levels of in-school transmission. They looked at three specific states that they were referencing in this, and they published some information from Utah, from Missouri, and Florida. And the information showed that the students that wore masks and followed other measures reduced transmission, and that 6 feet number didn't matter so much. So just breaking down the data real quick for you. Florida, 60% of the COVID cases among students not school related. The CDC and Florida Health Department researchers took a look at the data. In Utah, the study found 86% of students wore masks in elementary school classrooms, and very few passed the virus on to others. And then Missouri was also part of this. 27% of schools were able to space the desks 6 feet apart, and they did an investigation and found only 2 people infected anyone else at the school. So when you take a look at the information that they were looking at in this, is it that the teachers or the administrators are able to say, hey kids, you have to keep your mask on, that they're able to really make sure they do it different than how we are out in the community where there's no real enforcement?
I would concur with that. So in school, it's a very controlled environment. The kids are keeping their masks on. The teachers are keeping their masks on. I can tell you in, all the cases that we've had, when we've contact traced it, it's always been outside of school. It's a pizza party with the soccer team. It's a sleepover. So in the community, kids are not wearing masks. People are fed up with the pandemic. And so it's community spread that then winds up being, landing in schools, but it's not being transmitted in schools. And so all of my messages to parents, I always end by saying, please continue to mask up outside of school, because it's that outside presence that then comes into our schools and could undermine things. But I would absolutely concur with that it's outside community spread and not spreading within the schools.
So Dr. McBride, do you think that next we're going to see the distance change outside of our classrooms, or do you see that not happening?
I just want to drill down into the point that was just made, that is an excellent one, that the schools reopening really shouldn't be tied to community spread. As was just stated, the spread in the community by asymptomatic people is the big driver of the whole pandemic, right? This invisible virus that infects people without them knowing it. They go out, they are closer than 3 feet, they sing, they talk, and they spread it. But the point is that schools should be able to open, even in places where community spread is high. Look at Europe right now. They're doing very, very well with school reopening. Schools are not the places where the virus is being transmitted, despite the variants, taking hold and spreading in through the community.